But the other balance we find is that stem cells don't work for everyone. It's a bit like a blood pressure medication, which works for one individual but doesn't work for another individual. We see upwards of 85% success in stem cell therapy using our technique in mild to moderate knee arthritis. That does drop to 75% if you have severe knee arthritis. It's still a very good response rate, but there's 25% in grade 4 bone-on-bone who don't get an appropriate response in regards to pain and function. In regards to level of pain relief, we have upwards of a 70% improvement in pain on an average for our mild to moderate arthritis. And if we're treating severe arthritis, which often comes with greater pain and more functional limitation, we have a 50% improvement. So for me, it's ensuring that patients understand what they may achieve with treatment, not thinking that this is a panacea, that this is going to cure everything. This is an incredibly good management tool, and it has an incredible amount of potential in medicine if we understand it and we use it correctly.
And why do you think, is it, I guess there might be ideas, and why it's different for different, are there any factors that indicate it may be better for someone else or not? Is it down to genetics, makeup, where they're from potentially? What are the kind of ideas behind that?
Yeah, you're absolutely right. Look, as a sports physician, musculoskeletal physician, I thought I was really lucky. Osteoarthritis, it's relatively simple, but when you really dig deep, osteoarthritis is an incredibly complex condition. It's not just a singular condition. It's not just wear and tear. The pathobiology now of osteoarthritis and our understanding of what influences osteoarthritis and that degeneration, it's an enormity of factors and influencing factors. It can come down to biomechanics. It can come down to environment. It can come down to race. It can come down whether your osteoarthritis is very inflammatory in nature or degenerative in nature. So it's a very complex condition, and those variables all have impact in regards to whether you have success. Now, that said, the benefit we have is we're not treating osteoarthritis with a singular compound which works on a singular pathway. So say you have different types of osteoarthritis, you've got a cell which can respond to the environment and go down different paths of action to achieve a balancing response, to achieve a pain and functional benefit. So you've got a very malleable cell which can adapt to the environment, and therefore that does create a relative consistency of outcome.